What's your view on this sort of piecemeal approach to provinces opening up boosters?
I think the messaging has gotten muddled around particularly the importance of the third dose. The big priority, and you could argue the single most important priority, is to get approximately the 10 million Canadians that do not have a third dose vaccinated. That's the best protection against a fall wave that might lead to an increase in hospitalizations, and it's our best tool that I'm afraid the message has been muddled. And as you know, the rates of third vaccinations have really much tailed off. Politicians have lost interest and the public has lost interest. But that remains the single most important strategy. And I would like to see a much clearer push on those before we even talk about fourth doses, which are relevant, but only for a really subset of the population.
How would you characterize this current wave? And was this expected, again, as public health restrictions dropped, people stopped wearing masks, and as well gathering like they were in 2019?
The wave was expected because we've seen in other parts of the world this variant, the BA.4/5, in Canada it's predominantly 5, has displaced the earlier BA.2 and BA.1. And the evidence suggests that, in fact, if you got Omicron in January, February, or in March, you can still get infected by this variant because it's particularly infectious. So that we expected from watching the developments around the world. What has appeared clearly in most parts of Canada is an increase in certainly the wastewater data, prevalence in the numbers of tests that are positive, and the number of local areas that are reporting big growth. So we're clearly in the middles of a wave. Now, the good news is there's some suggestion that that might peak hopefully by August or mid-August, and then start declining. In other parts of the world, they did see a modest increase in cases and a modest increase in hospitalizations. But every part of the world is different, and we can't assume that here. So I come back to the core strategies of, I believe we really should be pushing for a third dose. In fact, I believe the definition of a fully vaccinated Canadian should be changed to 3 doses, not 2. And we should really insist on masking in closed indoor spaces. Those are the 2 best tools that we have, and we're not using them well.
Doctor, last question for you this morning. What are you seeing at St. Michael's where you work? What's happening with hospitalizations?
There is an uptick in hospitalizations, thankfully not serious hospitalizations, so ICUs and others haven't gone up very much, but there is a notable increase. And that is the concern, is that if this variant is more infectious than its predecessors, then and vaccines do some protection against infection, they provide excellent protection against hospitalizations. So we've got to be very diligent, and I come back to that core message, third dose and masking.